Thanks for participating in the Closing the Gap in Childhood Obesity Forum that the Clinton Foundation is hosting in partnership with the Robert Wood Johnson Foundation and Grantmakers in Health. I want to thank especially Risa Lavizzo-Mourey and the Robert Wood Johnson Foundation for their support for this important event. Although progress has been made in the fight against childhood obesity, today still 1 in 3 children is overweight or obese, with our nation's most vulnerable children disproportionately impacted. No child's health fate should be determined by his or her zip code. That's why I'm so grateful that you're gathered here to think about what's next. Now we take what we've learned over the last decade, continue to scale up what works, and build new and innovative approaches to closing the inequity gaps that remain. I hope you will be bold in your thinking today and focus on building creative partnerships to ensure that every child in the U.S. has an equal opportunity to be healthy. Thanks. I'm looking forward to your results.
Please welcome to the stage Chancellor, Rutgers Biomedical and Health Sciences, Dr. Brian Strom.
Thank you all, and it's an honor to be here. I'd like to begin by thanking the partners who are sponsoring today's forum, the Clinton Health Matters Initiative from the Clinton Foundation, Robert Wood Johnson Foundation, and Grantmakers in Health. I'd like to welcome all of you to New Jersey, both those physically present and those joining us virtually as well. I've had the privilege of serving as Chancellor of the new Rutgers Biomedical and Health Sciences now for 5 months. We are a statewide organization, but we're headquartered here in Newark, so we are your neighbors right nearby here. Perhaps surprisingly, for those who first conceptualized the position I was fortunate to join, in addition to being a clinician, a general internist, I'm also a public health person. I have training in public health and developed, before this, a public health-oriented program. And indeed, in my prior job, recruited one of the nation's leaders on studies of obesity in minority populations to our faculty. Obesity in children is a massive public health problem, nationally and locally. Nationwide, nearly 1/3 of children and adolescents are overweight or obese. 25% of New Jersey adolescents are overweight or obese. Nearly 30% of New Jersey children as young as 2 to 5 years of age are overweight or obese. Turning specifically to Newark here, things that are actually much worse. A full 42% of adolescents are overweight and obese in this city, and a remarkable 45% of those ages 3 to 5 are overweight and obese, in contrast to 21% nationally. So this is a very large national problem. It is an even bigger problem in New Jersey and a bigger problem yet here in our neighbors of Newark. So it is my pleasure to introduce the session today and to see what emerges from it. It's also my pleasure to move on to introduce the next speaker, Risa Lavizzo-Mourey, a professional and also personal pleasure to introduce her. Risa is president and CEO of the Robert Wood Johnson Foundation, a position she's held since 2003. The foundation is the nation's largest philanthropy dedicated solely to health and healthcare. With more than 30 years of personal experience as a medical practitioner, policymaker, professor, and nonprofit executive, Risa has built on the foundation's 40-year history of addressing key public health issues by adopting bold, forward-looking priorities. A specialist in geriatrics, Risa came to the foundation from the University of Pennsylvania, where she served as the Sylvan Eisman Professor of Medicine and Healthcare Systems. She also directed Penn's Institute of Aging and was chief of geriatric medicine at Penn. Again, from a personal point of view, Risa and I go back to those days, because I also just recently came from Penn, and I've had the pleasure of knowing her as colleague and friend now for decades. A graduate of the University of Washington and the State University of New York in Stony Brook, Risa earned her medical degree from Harvard Medical School. She holds an MBA from the Wharton School at the University of Pennsylvania. So thank you all, and let's welcome Risa Lavizzo-Mourey.
thank you, Brian, for those kind remarks. You know, whenever I hear that kind of introduction, I always wish my kids were in the audience, so I'd get a little respect. Brian and I go way back, as you heard, and it's great to be working with you again, Brian. And welcome, all of you, to Newark and to this great conference. It's wonderful to be working with the Clinton Foundation and Grantmakers in Health, because without their leadership, we certainly wouldn't be here today. And as I look out, I see that a lot of you have traveled a substantial distance to be here, so welcome to New Jersey, and thank you for joining us. You know, New Jersey's the home state of the Robert Wood Johnson Foundation, and while we operate nationally, we always view the Garden State as having a special place in our hearts and in our work. We began our work as a community foundation just about 30 minutes from here in New Brunswick, and we honor that work and the legacy of our founder by trying to bring forward dynamic leaders, good work in New Jersey, and showcasing it whenever we can, so that everyone understands that New Jersey is really a part of trying to build a culture of health. Now, the philanthropy of Robert Wood Johnson originated and was guided by his strong commitment to reducing inequality and expanding opportunity for good health to everyone. I see lots of longtime friends out there in the audience, people that have worked with us over the years, and I want to welcome them. I also want to welcome some of the new faces that I see. And I know, looking out in the audience, that there are lots of MDs and MPHs and people that are familiar with the nonprofit and philanthropic world. But for this summit, we also want to expand who's here. So as you look around, you may be sitting next to someone who's an executive in the high-tech industry, someone who's in finance, an architect, a community developer. And I want you to know that you are all public health champions. You may not have realized it until this moment, but you are all public health champions. And at RWJF, we believe that everyone has a role to play in ensuring that we have healthy communities. Our challenge is figuring out the best way to work together so that all of our people can live happier, healthier, and indeed longer lives. What I really want you to understand is that you are the key reason that we're here. Because, as Brian has said, as President Clinton has said, we have a really tough puzzle ahead of us. And in order to solve it, we're going to need your help. The stakes, as Chancellor Strom has said, are very high, and the solutions that we're going to pursue and likely adopt are going to be shaped and strengthened by the discussions that we have today. If we do this well, we will have an even greater chance of turning around the childhood obesity epidemic by 2015. But it's even bigger than that. Because while our goal is to reverse the epidemic in childhood obesity, our ambition is even more audacious. We kicked off the year at the Robert Wood Johnson Foundation with a new vision. Our vision is to build a world, a nation that's strong and vibrant, and where a culture of health is the culture that we live. A culture where being and staying healthy are top priorities. A culture where their communities offer a wealth of opportunities so that people can make healthy choices, and that those choices aren't going to matter where you live, where you grow up, how much money you have, the color of your skin. Now, we realize that such a vision includes reversing the childhood obesity rates, and that if we develop such a culture, these rates will fall. But more than that will happen. Chronic disease rates will fall, and the untenable spending that we do on healthcare will also decrease. But most important, all of our people, and I do mean everyone, will have the opportunity to enjoy healthier lives. Now, we're under no illusion that this is going to be easy. For starters, it's going to require cooperation among health and healthcare, to be sure, but also schools, also parks and rec. But that's not all. We're going to need everyone to play a role in trying to make our communities healthier and preventing childhood obesity. And that's really why we've convened you here today. We need your help to bring about not only this reversal in childhood obesity, but to lead us towards a culture of health. And we know that today we're going to deal with some of the biggest barriers that we face. And we expect that you're all going to dig in, you're going to work hard and help us focus on this very urgent problem of how we address equity and in preventing childhood obesity. The lens is particularly important because after years of bad news, of seeing nothing but rising obesity rates, we're finally starting to see some progress, real progress, and it's a really big deal. But we're not where we need to be yet. You all know that. We can't let up the pressure, and we have to build on the progress that we've had so far to ensure that the benefits that we've seen are enjoyed by everyone. Let me just show you a couple of slides to show you what I mean. In the 1980s, you can see childhood obesity was relatively uncommon. Only about 1 in 20 kids met the CDC definition of childhood of obesity. And the prevalence rates, as you can see, stayed pretty much steady. And then, boom, childhood obesity rates started to double, triple, even quadruple in some populations. Public health officials sounded an alarm, and recognizing that this was a very severe threat to the nation in 2007, there we go. In 2007, we focused $500 million on reversing that epidemic. We set a goal of 2015, and the last I looked, that's just a year away. So I'm getting a little nervous. Now, we never believed that there was going to be one single silver bullet that would reverse this epidemic. Obesity is a tough, multifaceted program. It's not going to be solved by one kind of intervention. Clearly, parents are critical. We need and expect parents to create healthy environments for their kids. But frankly, research and common sense tells us that parents need help. Parents can't tell kids to go out and play when parks are closed or unsafe. We can't expect parents to prepare healthy food and meals at home when they don't have access to fresh, affordable food. And you don't have to go very far beyond the doors of this lovely museum to see the challenges that confront people every day. So we're not alone here in Newark in facing those challenges. They exist all across the country. They're barriers that prevent people from having healthy choices, convenient choices that will allow them to make those healthy choices the default choices. We all know that this needs to change. So how do we give kids a fair chance to have a healthy weight and to live a healthy life? Well, at the foundation, we decided to focus on 6 strategies that research tells us have the greatest possibility of reducing the obesity rate. So let me show you what they are. Improving national nutritional quality in snacks and beverages. Increasing access to playgrounds and walking paths and bike lanes, really anything that gives people the opportunity to be active. Increasing access to healthy, affordable foods in communities. Helping schools and youth-serving organizations increase activity for kids. Reducing the consumption of sugary beverages. Protecting children from marketing of unhealthy foods and beverages. Now, finally, we're seeing results. The trends in childhood obesity rates have stopped rising, and that's welcome news. Even better, when we look at some age groups, we are more than holding the line. In the youngest children, we're starting to see a clear downturn, and that's critically important because we know that when kids have a healthy weight at a young age, they're much more likely to have a healthy weight in adolescence and in adulthood. Now, there's more good news. From a national level, among the places that were the first to adopt comprehensive strategies, we're actually seeing even more progress. In West Virginia, they focused on schools, they improved nutrition standards, they revved up opportunities for children to be active during the school day, at PE and at recess, and even during class. And guess what? 8.6% decrease. In Philadelphia, they pioneered new financing strategies to bring full-service grocery stores into underserved communities. They improved food and physical activity in schools. The city passed a Complete Streets program that makes walking and biking really appealing throughout the city. And I should know, I now live in Philadelphia. Guess what? There's been a 4.7% decrease. And in other places, it's happening all over the country. California, Mississippi, Anchorage, North Carolina. This is real progress. It shows that when communities come together and have the resolve to act, we can reduce childhood obesity. And there's even more good news. I want to take a closer look at what's going on just across the river in New York, where the city has clearly pursued an agenda for reducing childhood obesity and improving health with vigor. They've led a very strong school-based program that prevents childhood obesity. They've increased the access to playgrounds and outdoor space. They've launched innovative partnerships to bring fresh fruits and vegetables into the communities. And look what's happened. If you look at childhood obesity rates, at this table you can see in the kids who are between kindergarten and 8th grade, among the white students, you see a decrease of 17.6 to 15.4. That's a 2.2 percentage drop. But look at Hispanic and African American students. Look at that last column. The decrease is only 0.9 and 0.4 respectively. And in kids who are high income versus low income, the disparity also exists. 2.5 percentage points drop among the higher income kids as compared to 0.5 among lower income. So despite the progress that we've seen in New York, the gap may actually be widening. These interventions, when they started, showed that there was about a 0.5 difference between high income and low income kids, and now it's 2.5. Now, this data in New York is particularly rich, and we can learn a lot from it, but the same thing is happening all over the country. We see these disparities existing in multiple communities, except one, Philadelphia. In Philly, they've managed to reduce the childhood obesity rates and also reduce the disparities. And we have to learn how Philadelphia did that. We have to understand what they learned from going neighborhood to neighborhood with their Get Healthy Philadelphia program and understand how to assess the challenges that they were able to address and bringing food to communities and increasing physical activity in communities and I think really that's our big question for today, is how we can make the Philadelphia experience the experience that we have all across the nation. And so our question, how can we ensure that the progress that we're seeing benefits all of us? Now, we couldn't be gathering to address this question at a more critical time. The fact that obesity rates are leveling off represents dramatic progress in our country. But these gains are really still very fragile. And if we're going to make these reversals stick and extend them to everyone in our country, we're going to have to be relentless in our commitment, relentless in developing new resources, and tenacious in achieving this goal so that all communities across the country can report findings similar to those in Philadelphia. Now, we've assembled 4 outstanding panels to try to frame this problem today. We're going to, in the first panel, which I have the pleasure of moderating, try to frame the issue of what causes these disparities and how we can address them. And then we're going to take a closer look at the food environment with the Today Show's wonderful Joy Bauer. We'll consider how we can address physical activity in the next panel after lunch with Jenna Wolf. And then at the very end of the day, Sanjay Gupta and his panel will have the responsibility of bringing it all together and telling us how we're going to actually close this disparities gap once and for all. So let me just remind you that whether you're up on stage or out in the audience or part of the live stream audience, we want your full participation today. We need all of your innovation and creativity, your determination, because we do know that we aren't going to be able to rest until we get a healthy weight for all of our children. Now, as I said, creating a culture of health has become RWJF's North Star. It's the aim, the focus of everything we do. And we believe that if we can achieve this, if we can achieve good health for every kid in America so that they will be able to benefit from all that life has to offer, we will have a great country. And we believe that businesses will be stronger and more competitive, and grandparents will be able to live in their homes longer, enjoy their grandchildren longer, if we can together build a culture of health where we understand that being healthy and staying healthy is a matter of fact, not a matter of chance. Those of you who know me know that I love African proverbs, and there's one that teaches the wise aim beyond the boundaries. So today I want to challenge you to aim beyond the boundaries, to aim high, so that we can work together to create a culture of health where everyone in our society can lead a healthy life now and for generations to come. So get ready, roll up your sleeves. We're about ready to get to work because we only have 8 hours and we have a lot to do. So with that, I'm going to move over to my next job, which is to moderate, and I know that my panelists are going to join me in a minute, and we are going to get started.
Please welcome to the stage Executive Director, Let's Move Initiative, Sam Cass, Senior Advisor, FSG and author, Leslie Crutchfield, Campaign Director, Moms Rising, Monifa Bandelli, President and CEO, Northwest Health Foundation, Nicole June Maher, and First Mover Fellow, Aspen Institute, Manoj Fenelon.
Great. Well, is this working? Okay. Let's get started. We've got a great panel here. And as you can see, the title of our panel is Closing the Divide in Children's Health, a place for everyone at this table. Now, our task is to frame the disparities question. We want to understand from each of you what you're not doing now that you could be doing that would actually close this gap. And with this panel and with every panel, big question, you ready for it? We want everyone to participate. So the idea here is to get some controversial ideas out. We want to declare this as a safe space for brainstorming. In my experience, when someone gets up and says, I'm not sure if I should really say this, it's usually a good idea that's going to come. So don't be shy about bringing forward those ideas that may seem controversial, may seem difficult. Get it out there. This is the kind of discussion we want to have. And that applies whether you're here in the audience or being streamed in. If you have a question, there will be microphones circulating, and just look for a microphone. Wait for the microphone so that we'll be able to hear your question. If you are out there in cyberspace, we want you to tweet your questions to us. It's hashtag Kids Health Matters, all one word, Kids Health Matters. And they will come on a screen, and we will be able to ask those questions to the panelists. So we will have about 5 minutes for each of our panelists to make a few comments, and then we'll roll right into the next one and ask questions at the end. We have until 10 in the morning, which is not very long, to deal with this very important question. So with that, Sam, I'm going to ask you to kick us off.
Thank you so much. First of all, I just want to take a minute to thank Risa personally for your leadership on this. You've been a huge part of, and the foundation's been a huge part of those numbers in decline. So thank you for all of your leadership, and to the Clinton Foundation.
Thank you.
To start by talking about all the things that we're not doing and to try to be controversial is not really what we tend to do coming from the White House. So I'm
But
going
you're
to
safe here.
And there's no safe space. So I'm going to start to talk about some of the great things that are happening, because I think one of the things that we run the risk of is feeling like this is an unsolvable problem. The forces against are too strong, and there's not the will. The fact of the matter is we're winning, and we are on the right path. We have a tremendous road ahead, but things are happening. And I think the First Lady came to this issue as a mom, really trying to unite the country around the health and well-being of kids and families. And so I'll be brief, Risa, I promise. But we're making some huge strides from all sectors of the issue and all corners of the issue. Schools is one of the places that we're seeing tremendous progress, and I think is an important place to start when we talk about disparities. Right now, 90% of schools have implemented the new lunch standards, and the meals that kids are getting are significantly improved. This fall, junk food will be out of our schools entirely, which is a huge deal. For the first time ever, there'll be standards on everything sold in schools. The First Lady recently announced with Secretary Vilsack school wellness policies, of which include a standard of what can be marketed to kids. Basically, if you can't sell it in schools, then you shouldn't be marketing to them either, which is a big, big, important problem. Marketing is also a huge part when we talk about disparities. The other thing, and this is very, very important, and I don't think a lot of people know this, we also rolled out community eligibility, which means that school districts that have 40% or more free or reduced in their school population can serve universal breakfast and lunch for all kids in that school. Now, access to healthy and affordable food is a huge barrier to overcoming this disparity gap. And we know that this kind of nutrition has a dramatic impact on test scores and on kids' hunger. As you know, we're seeing, if kids have breakfast in schools, we're seeing a 17% increase in test scores just in school. So it's a huge part of, I think, a strategy of overcoming disparities. We're also working with a broad coalition to ensure that our schools are safe places for kids to be active. We have over 8,500 schools that are rethinking the entire school day from before, during, and after school to ensure that they're getting the activity that they need. And for so many kids at home, they don't have safe places to play. So we're making huge strides. I'll focus a little bit on marketing when it comes to disparities, and then I'll pass it over. There's so much more to talk about. Right now, African American Latino communities are over-indexed dramatically for the amount of marketing that's targeted to them, seeing way more ads for junk food marketing and other marketing for products that are undermining their health. I think we have a lot of work to do to ensure that as a community, not only are our kids particularly are not being exposed to marketing that is undermining their health, but also, and this is a place where I think we can do so much better, is start marketing health, start marketing healthier products, start marketing fruits, vegetables, water, being active in a way that's appealing and fun. The First Lady's done a ton of work on this, and she will continue to. But the notion that somehow we can walk around with a pamphlet and talk about broccoli is vitamin B, we really think you should eat it, which has kind of been our strategy, in the face of the most brilliant, beautiful, emotional marketing that makes you want to be full of love and happiness if you eat this or do that, we've been losing. And so a big part of our job, and I think a place where there's just big opportunities and not anywhere near the same kind of barriers, is bring that same kind of approach, which is research-based and really sophisticated, that we invest in as a community, to make this way of life, this culture of health that Risa talked about, something that we all aspire to and really want to do. And that communication has been lacking. Is that okay?
That's great, Sam.
Ooh, good.
Leslie.
Thank you, Risa. I'm so delighted to be on this panel and excited about the conversation today, particularly because at FSG we are a social impact consulting firm, and we work every day with foundations and companies, governments, and nonprofits to try and find better ways to solve social problems, and obesity is certainly one on the top of our list. But not just on a professional level, personally, I'm really interested in being part of this discussion. As a mom of 3 kids, 2 of my kids attend Montgomery County Public Schools, and even within our relatively strong school district, you see the disparities across the county in low-income and upper-income schools and the lack of access. So I'm particularly interested in this discussion of the gap and the lack of access to opportunity and how we can solve that. In fact, coming up to New Jersey today for I flew in last night from Washington, D.C., where I'm based, and Sam and a few others are based, and it reminded me that I was just up in the city a couple weeks ago for spring break. And when I told my 9-year-old and 7-year-old we were going to New York, they said, "New York City! So exciting. Can we go see the Statue of Liberty?" And I said, "Yeah, we can try and put that on the agenda." And my daughter said, "Because it said that there's a restaurant in her nose." It turns out there's not. But if there was one, it would have only healthy farm-to-table fare, I'm sure. And as I said, we're really interested at FSG in solving social problems, working with organizations. I'm not an expert on how to tackle the obesity epidemic, but what I've thought a lot about and what FSG works on is trying to help organizations figure out the process for social change and how to enable that to happen. And I want to share with you some examples, not just from obesity, but from other issues, because I think what we're not doing in obesity, we can learn from some of the other areas. I want to share with you a quick public health story from another issue to get it off the obesity issue for a second. And let's talk about substance abuse and the problem of teen binge drinking. There's a case in Franklin County, a rural part of Massachusetts, where you have a community that had extraordinarily high levels of teenage drinking, tobacco use, marijuana use, almost double the national average. Imagine going to this rural part of Massachusetts, not much going on, a lot of rural roads, some mung bean farms here and there. Why did they have such an extraordinary high rate, and really an epidemic of teen drinking? Well, community leaders got together in this area because they were so frustrated with this problem. And at first you could point, well, it's the teens, right? They're the ones at fault. They're drinking too much, and they're getting in accidents, they're hurting other people, they're killing themselves, and they're ruining their life chances. But when you start to peel back the onion of this very complex problem, you start to see that it's more nuanced, right? Well, where are the teens getting the alcohol? Well, liquor stores are kind of turning a blind eye and serving beer and alcohol and liquor to minors. And then you peel it back a little more. Well, the county's involved, law enforcement, because the police aren't really enforcing the liquor stores who are selling it. And then you peel it back a little more and you look, well, how are the parents involved? Not only do the kids not necessarily have access to more productive things to do in the afternoons and evenings, but the parents have a culture, many, of openness to alcohol, taking sips of wine and beer at the dinner table. And you start to look at the whole community, the norms, the values, the role of government, the role of law enforcement, the role of all of the actors in the community. It's everybody's problem, but no single one of them is solely responsible for solving it. And the trick that worked in Franklin County to reduce that binge drinking and alcohol abuse rates by more than 30% over a 5-year period was when 2 nonprofits came together with some funding from the CDC, and actually RWJF was one of the funders of this, incidentally, and they said, how can we work collectively to track the data and tackle this problem and create a collective impact on the issue? They were able to reduce it by 30% over a period of time. And the trick wasn't necessarily because they poured millions more into the issue, but it was simply by getting all of the actors, the business, policymakers, community members, nonprofits working together towards a common problem in a different way. And at FSG, this is something that we call collective impact. And funders that are able to see the collective rather than the individual, I think, are going to get closer to solving this issue. And it's because fundamentally funders that want to solve problems need to understand that the societal issues like obesity are complex, as you mentioned in your opening remarks, Risa. Now, if you think about it, there's kind of 3 ways to bucket problems in society. There's simple, there's complicated, and there's complex. Simple problems, take a challenge like baking a cake. You know, you follow the recipe, you put the flour and the sugar and everything together in the oven. You're always going to get the same outcome if you follow the recipe. Other problems are complicated. The authors of Getting to maybe talk about putting a rocket on the moon, right? You have to, incredible complicated feats of engineering and physics, but if you make the machine just right and you point it into outer space, you can count on gravity to behave the same way every time. Our problem, the obesity epidemic, is complex. You can't follow the same recipe to solve it in every community. You can't just use complicating technical solutions. You have to have a complex response. And the problem we at FSG see in our work with foundations around the US and also overseas is that particularly foundations are trying to attack the problem like it's a simple problem with simple solutions. And we have to have a complex response. Now, to get the complex response, that's where it becomes incumbent on funders to look for the opportunity for all players in society, nonprofit, business, government, to come together in collective approaches. And often that means funding the process of collaboration and what we call collective impact. But we're stuck, to your question about what are we doing wrong, we're stuck because funders continue to fund what we call nonprofits and isolated impact. Getting them moving in the right direction is the trick. You talked about we don't have silver bullets. What we do have in the social sector is silver buckshot. And the challenge for funders is to get that buckshot targeting on solving the problem.
Okay, that's a nice visual. Silver buckshot. Monifa is someone who knows how to spray buckshot in a great way. Give us a few words of wisdom.
Sure, thank you so much again also to RWJF for having us here and for supporting this work for over the past 3 years. The piece that I want to talk about is the critical importance of parent-led advocacy and organizing. I think we know it now, and we're starting to invest in it, but parents are the #1 foot soldiers, and they're also the best PR firm that you can have on any issue. I don't care what it is that you're trying to actually do. And we even see that some of our colleagues here, even corporations, the corporations know the importance of activist moms and of bloggers. And so at Moms Rising, with our 1 million members who live in all 50 states and our bloggers, we try to activate them on this issue, working to help improve school foods, helping to implement those new meals that Sam talked about, softening the ground for the smart snacks that are coming. And we find that it's a completely different arena when a parent says, this is what I want, versus the messaging that we hear. People feel that there's some kind of nanny state, and this is coming from somewhere on high. So that on-the-ground mobilization, that on-the-ground presence, the messaging coming from the bottom up is key to success for all of our policies. And how do we do this? Well, we find that there's 2 big barriers to parent interaction and parent organizing. One is the busyness of the modern parent. We have all kinds of things to do. I don't even have to go into the full list. And then you call someone, you're like, and we want you to help us implement smart snacks in schools. Moms are like, what? And then the second one is the noise. We live in a time now where people are receiving messages through media constantly. When they're driving down the street, there's billboards. On their phones, there's ads popping up. Their church wants them to do things. The school wants them to be involved. Moms Rising is sending them emails, asking them to join tweet chats. How do we break through the noise? And also, how do we engage people who are very busy? And so our formula is what we call the layer cake. We like to create multiple layers of engagement so that someone can do something so simple and feel so good about it that we can trick them and walk them up these layers of engagement in order to get them to do things that are more time-consuming and more resource-consuming. And so our layers go from first partnering and collaborating with other organizations that also have constituents, but also the public health sector, people who are working in all kinds of arenas that have the expertise, the content, the research that we need to educate our members. That's our first layer. The second layer is what we call our one-click advocacy. We send something out to our members that they can just sign on to. They can just share their story. They can write a quick blog and submit it, and we use their voice on the issue, and they never had to leave their home. They never had to leave their desk. So that's the one-click advocacy. And we also take the one-click advocacy beyond our email list. We'll put links to take action in articles where we blog on Huffington Post or on Ebony.com or on Mommyverse. And so we try to really broaden this ability to cast a wide net on the issue. Then the third level that we do is we take those moms who have a little bit more time to be proxy for all the moms that didn't have any time. So we collect those stories, we collect all the signatures, we collect the comments like we did last year with the comments for Smart Snacks. And we ask people who can come out to actually be a presence and a force for the voices of those who can't be there. And we collect those storybooks and we take them to the White House and we hit Sam Cass over the head with them, and we'll take them to the USDA, and we'll make sure that our representatives know about them, even though we don't lobby with any Robert Wood Johnson Foundation funds. And
Thank you.
And we just make sure that the proxy member, now she's got a little more time, she's on the next layer of engagement, she can really be a voice, but she's representing a bag that she's got that has 60,000 comments in it. So she's actually a powerful voice, even though she's a proxy. The fourth piece, the second to last piece, is on-the-ground action. We find it is very important not to just exist in cyberspace, but to make sure we have events that people can come out to and be a part of. And last but not least, because I see my time is clicking off, is media, traditional media and new media. I want to quickly say that there are more readers now of the Huffington Post than the New York Times, and there are more people on Facebook than live in the United States. So there's a power force out there where not only can we get stories put in the traditional media, but we recognize that each and every one of our members is their own media outlet through social media. And we engage many of you out there in some of those platforms like Tweet Chats on Food Friday and our Facebook campaigns. So I'll talk some more when we have the questions and answers because my 5 minutes is up. But those 5 layers are just a snapshot of how we believe we can walk people up the ladder of engagement from very little time and very little resources to being a big-time spokesperson and advocate. And what we like to do more of is just increase the layers. Thank you.
Great, thank you. So we've got some great metaphors here. Silver buckshot, layer cakes. Nicole, we can't wait.
Thank you. I want to thank my fellow panelists and build on some of their comments by talking a little bit about the role of philanthropy in racial equity and also the journey that Northwest Health Foundation has been on. So I think that everyone in this room is entirely aware of the emerging majority in this country and the incredible pace that we are on where this country, and in particular our children, are diversifying. And I think that at the Northwest Health Foundation, we've been thinking about this for quite some time and thinking about how, in fact, those children from low-income communities and communities of color actually represent our absolute best opportunity to improve outcomes as it pertains to many issues in health and, of course, in healthy weight. And as a foundation that's in the Northwest, sometimes we get a reputation of being a region in the country that's not that diverse. But I think we're an interesting region because while there are other regions more diverse than us, we are still a state that 38% of our children under the age of 18 are people of color, and our children under the age of 5 are majority minority. And we experience, like most of you, greater indicators of unhealthy weight in our populations from communities of color and our low-income white communities, particularly in rural communities. And as we thought about the impact we could have as a foundation, we really thought about how we need to reframe the opportunity and think about our role and how philanthropy really needs to step up and be a little bit more courageous and be thoughtful about how we can invest our dollars. We're also a state similar to national trends that historically has underinvested in the very communities who have the greatest need. And as a board and a leadership team, we began to examine this phenomena and really say the change needs to start with us. We need to have a board that reflects the very children and communities we're talking about. We need to have a staff that is not only racially and ethnically diverse, but also has experience from intergenerational poverty and actually has experience solving these communities in the ground. And if I could give you one takeaway, I would really encourage our philanthropic leaders and our nonprofit leaders to think about that. Being a person who is of Native American heritage and being in the public health field, I can't tell you how many times I have sat in room after room after room of incredibly well-intentioned, thoughtful experts in health and had almost no one in the room reflect the very children and families that we're talking about. And what we're excited to be thinking about at Northwest Health Foundation is to really change that equation and really invite the very people who are from these communities who have the deep expertise, knowledge, and experience about how to change culture in their community, be at the table and bring their solutions. And actually, as we looked around the country and in our own backyard in communities who had really made significant change and improved their outcomes, we noticed some very interesting trends. We noticed that when leaders who reflected the community were in the room and they had shared power in decision-making, and that the process was actually supported and capacity was built for leaders to implement the vision for health that they had, we saw change occur. Every single time. We saw when there were top-down imposed solutions where health experts came and explained what the community should do and there was not community buy-in and communities were not part of creating the policy, you would have significant amounts of money spent and the impact wouldn't be there. And so while we're a foundation that absolutely believes in population-based approaches, we are incredibly excited about far-reaching policy to have physical activity in schools and healthy food in schools, we also believe that we will not get to where our children deserve us to be without the very communities suffering the worst outcomes being the leaders and being at the table. We also know that when you listen and invite communities to come in, you're going to hear different things, and it may make you feel uncomfortable. It may not be the health solution that you wanted or started, or the thought you were having when you started the process. For example, when we got out and really listened to communities, we heard that communities care a lot about physical activity. They care a lot about nutrition, but they also want to have a conversation about the impact of child abuse and neglect and how that impacts obesity outcomes. How healthy pregnancy is important to creating healthy weight for a lifelong of health. And so I would just encourage you to think about how you can change your table, and I would encourage you to think as a philanthropic organization and a nonprofit to think about how you need to think of your own structure, your own leadership, and your own standard of how you partner with the community first.
Terrific. Thank you, Nicole. Last but not least, Marcia.
I do have a metaphor for you. Well, thank you first for having me. It's a privilege and an honor to be in such august company. And it's also a challenge to go last, because it's tough to add to the conversation when so many people at the front lines of this battle have said so much. I just thought I'd offer up 3 ways maybe to look at this topic slightly differently. And I'm very conscious of the fact that I'm certainly not an expert on this topic. But what I think I have is a slightly different vantage point on which to look at this. And I'll start with a personal story. I come from India, I grew up there. And this is not the result of a scientific survey by any means, but just growing up, I'd never put problems of being overweight or obese together with being poor. Because in India, at least at the time when I was growing up, I never saw that. I don't think I saw a single person who was both overweight and poor. So coming to this country, it really mystified me for a long time that obesity or the problem of being overweight in this country was disproportionately a problem of the poor. So that started my sort of engagement as a private citizen, I think, with this topic and trying to look at it. And I have the benefit of a graduate training in emotional communication. So the first reframe, I think, might be to look at obesity as a problem of emotion, primarily. And I know Sam touched upon this a little bit with his broccoli example. And I think one of the strains I see in approaches to solving this problem is to go the entirely rational route, which is common across a lot of solution approaches, which is configuring the problem as an issue of a lack of knowledge and not the right kinds of attitudes, if you will, without focusing on the emotion part and how emotion drives behavior very directly and almost short circuits a lot of the information that people do have and some of the rational attitudes that people might have. And I think this is also a view that, to Monica's point, a lot of the people who are suffering in this battle, I think, are well aware of. So it almost sets up a strange dynamic where the experts are coming to them with a view of the problem that the people in the trenches don't agree with intuitively, right? And we've all heard of stress eating. I was talking to a German friend of mine not too far back, and in Germany, apparently, they actually have a word for it. I'm going to mispronounce it because I don't speak German, but it's something like Kummerspeck. And very literally translated, it means grief bacon. So the Germans have figured out at least one aspect of the problem, I think. So that's the first one, to maybe look at this as a problem of emotion. And very closely associated with that is the problem of stress. And when we talk about approaching this as a systemic issue, that's the variable that stands out to me. That communities that suffer from this problem are disproportionately affected by stress. And I also want to stress, pun intended, that I'm talking about environmental stress mostly. So we should probably try and take this away from a sort of individual stressors approach to people living in low-income communities or minority communities are just subjected to massive amounts of environmental stress. It's almost like you're starting from a different baseline. And how does that sort of background all of the problems that those communities face, obesity being one of them? So maybe taking a systemic approach and trying to solve for stress might actually be solving for a lot more than we think. And last but not least, I also wanted to approach this problem of access and very much echo the points that you made about how do we create, and this gathering is a fantastic start, I think, in terms of the kinds of constituencies you have represented around one table, is the way to go. And I'd be cautious about repeating the mistakes that people in international development have made, which is sort of a version of the white man's burden, where people come in with this attitude of like, we know best and we've figured this out and we've done all sorts of sophisticated research. And the valuable on-the-ground knowledge of the people gets lost in the process. So to the extent that we can include their voices and their knowledge, I would say, it's just not including their voice as a sign of courtesy or respect, but to appreciate that those people might have insights into their own condition that may not be available to the rest of us, and taking the route of empathy. So I'll sort of stop there.
Great. Well, clearly we've got a terrific panel. And I'm going to lead into the first question, which we actually have gotten over Twitter. So those of, and I understand we have some 700 plus people out there listening to us. So we do want to hear your questions. But all of our panelists have emphasized different organizations or groups or approaches that we need to bring to the table if we're going to decrease this gap. We've heard about the role of policymakers and a strong voice in the First Lady, someone who really knows how to energize and inspire people. We've learned about bringing together a community through data and process to address any problem, but particularly childhood obesity. The role of parents in this movement, bringing kids and people from the community in and really understanding what they want and moving the needle that way. And then bringing in a psychological view that addresses the needs of the community and focuses us on the emotions. So we heard a variety of different perspectives that we need to bring to the table. But Jake from Facebook asks us whether there's some organizations that are playing a real role in helping communities be healthier that we should highlight. And so I guess his question and mine to you is, who else? What other organizations, what other perspectives do we need to bring to the table if we're really going to address this? Who wants to go first? Monifa, go ahead.
Okay, I think it's a really good question, and I wanted to say that to Jake, that first, we'd love it if you could incorporate what we're working on and these issues here in the organizations that you're already a part of. And that it's a good question, but we don't want to say that this is really about finding and going outside of where you already are. I think it's very important that your church, your block association, your civic group, wherever you're a part, you can tap into these organizations here and inform that organization and activate it on this issue of childhood obesity. That's number one. And number two is that there is also a movement right now that's bringing in all kinds of membership-based organizations that aren't quote-unquote public health organizations onto this issue. So you may even find that your local NAACP, you may find that your fraternity or sorority may already be on this issue. We, of course, say to, check out momsrising.org as we have members in all of the states. But you may be a part of something else, and we'd rather help you engage that organization than to actually bring you into what we're doing, or both, I should say.
So one of the things we say at the foundation is health begins where you live, learn, work, play, engage. And I think that's really what you're saying. Take this issue to the organizations in which you already work. Other perspectives?
I'll try one.
Okay.
I'm not very, well, this is not a judgment at all, but the way I see the world moving is away from a focus on organizations to a focus on networks. So I'm guessing, I don't know Jake very well, but Jake's already part of so many networks, I'm guessing, that may or may not be focused on this issue. But turning the power of those networks onto this topic might be a way to supplement some of the work that these organizations are doing. And fantastic innovation, apparently, is how do I call it, has much more deep roots and soil in these sort of loose ecosystems of networks than in organizations typically. And I'm not referring to any organization in particular, but the dynamics of big organizations especially tend to discourage innovation. And just to give you an anecdote, the Indian Space Research Organization recently made the news for putting a mission on Mars. Nothing remarkable about that, it's been done before, but they did it for about 10% of the cost that it took to make the movie Gravity. And this was all coming from very grassroots innovation that got folded up into this larger exercise. So I see a lot of innovative ideas and new approaches actually coming from ordinary people rooted in these communities, working together largely outside of organizations, but not with a divide saying they can't enter into the organizational space. So it's sort of an interesting flow of ideas.
Leslie, do
In
you wanna
terms of
weigh in?
specific organizations or resources, I could point, Jake, to there's a really great example of a community that's actually been able to reduce obesity through a collective approach driven by an initiative called Shape Up Somerville. It happens to be based in Somerville, Massachusetts. And there's a case study about how nonprofits, schools, the city government, and businesses came together to actually help children lose a pound a year over a period of time, while the rest of the population comparatively was gaining a pound a year. It's a collective impact case study, and there's a website that has a number of cases and tools for organizations that want to do this kind of work. It's called collectiveimpactforum.org. And we welcome members of this audience and people online to share their stories of success as well on this forum, because it's an open source opportunity.
I see Sam has his microphone in hand, and he's going to want to make a comment, but I also want to let people in the audience know that your questions are welcome, and I know there's some microphones out there, so if you just raise your hand, we'll get a microphone to you, and then take your question. Sam, did you want to make a comment while we're getting the microphone over to this woman sitting
Let's go to
free?
the audience.
Okay.
Hi, thank you. I'm a school nurse from New Jersey, and I just had a question really about, have you guys collected any data in terms of where you've had success, and are there school nurses or healthcare providers in schools? Because we do have a national problem where we don't have school nurses in every school in the nation, and I really feel like school nurses are the foot soldiers, as you mentioned, to bring together communities and the administrators in schools to try to make some progress. I just wanted to have you remember that organization when you're making, brainstorming ideas, because I certainly have a lot of ideas for my community. We are 98% Hispanic, 98% free and reduced lunch, so actually we're going to be rolling out some policies with the Alliance for Healthier Generation in the fall. And this is really a great time for me to come together and hear you. But I just wanted to know if you had any data on that.
Does anyone want to take that? Go ahead.
Thank you
Nicole?
for that question. And I think that, after today, we can point you to some pretty amazing evidence about the impact that having a school nurse and a health presence in a school can have. Northwest Health Foundation is proud to have both been a partner with RWJ on a nursing initiative and also have extensive partnerships around supporting health in schools. And I think, just to expand your question a little bit, I think there is an absolute tremendous opportunity to partner differently between the fields of health in the educational setting, and I think there's many ways that that can happen. I think expansion of school-based health centers is very important, but I also think the best opportunity for broad-based prevention really lies within our schools, and I think that the opportunity that we all have as health experts and professionals is to figure out how to be a great partner with education. So it's one thing to look at the opportunity, it's another thing to really understand the complexities and needs of schools and think about how to support those schools in a way that they want to be supported. And so that's how I would answer that.
I wanted just to add quickly, if you could also share your story on any platforms, but it's really important that when school nurses hear from a school nurse who's thinking about this and working on these issues, then like wildfire, others will share their stories, and then you can have a network within a network of folks. Partnerships between parents and school faculty would emerge. So I just wanted to throw that out there. If you could connect and share your story, that would be another powerful way to connect with others doing the same work.
Great, we have some more questions, lots of questions now. This is great. Right here in the back.
Yes, hello. My name is Eli Wolf with the Institute for Human-Centered Design. And I wanted to just ask a question when we're talking about everybody here. If you could just address some of the initiatives and programs for children with disabilities and kind of what is going on and how you see that population at the margins being brought to the center. So thank you.
Sam, do you want to take that?
Sure. This is a very important issue to us, and one that there's an extra set of challenges. Particularly around being physically active is the place that we focused a lot on and are trying to do a lot of work on. We've found great opportunities partnering with the Special Olympics and showcasing incredible stories of people overcoming disabilities and doing things that we could never dream of doing. And really, part of it, what we've seen is that making that connection, even in and of itself, giving the courage and the strength to be brave enough to try to really do things that people have been told for their whole lives they can't, has been a really powerful tool that we've seen really catch on. And when we're thinking about all of our physical activity initiatives, we're always trying to make sure we're taking into account for those communities extra resources or extra guidance, and particularly in technical assistance, because a lot of communities don't know what to do. And providing those simple, here's the best practices about how to make these programs available to all is something that has been also quite important.
I see that Nicole wants to make a comment, and I just will add to Sam's that in reviewing the literature on how to really encourage the implementation of CDC guidelines for physical activity, I was part of doing this as part of the President's Council for Fitness, Sports, and Nutrition last year. And there's really a deficit of information on what really works in kids with disabilities. So for researchers out in the audience, we really need more information on what programs are most effective. We always try to use an evidence base, and sadly the evidence is not as strong as it could be. So there's a research agenda there as well. Nicole?
I really appreciate that question, and this is an area that we have really focused on through our own equity lens, really calling out disability as an important priority, because as we well know about the disparities for racial and ethnic populations, when you look even deeper, the population with some of the most significant disparities are actually folks with disabilities, and then even deeper, people of color with disabilities. And the one thing I wanted to share is that as we looked at initiatives to really increase physical activity, there is a national program that we have in our backyard as well called PlayWorks. And the thing of beauty about this program is it is a wonderful way to engage every child on the playground, but more importantly, the way that it engages children with disabilities and their family is really truly phenomenal. And if I could invite everyone to look deeper into that opportunity, it's wonderful for everyone, but in particular, it's probably one of the best initiatives that I've seen that really engages children in the entire spectrum of disability to participate on their terms in really empowering ways.
We're going to go to a question over here. If you want to learn more about PlayWorks, we've got a lot of information about it on our website, rwjf.org. Please.
Good morning. My name is Hannah Hamdi. I'm an assistant professor at Rutgers Medical School. I am a systems scientist, and the challenge, with the focus of childhood obesity, and the challenge is to find funders who look at obesity systemically. The fundings are either bifurcated to physical activity and healthy eating and ignoring a slew of other issues that are within the community, violence, dilapidated homes, and others. How do you engage and convince funders that eating healthy is part of the issue? Physical activity is definitely an issue, but it's not the only two issues, and that we need to take systemic and simultaneous approaches.
Okay. So for the funders up here,
I would just say, and I'll try to be brief because I know everybody wants to get in on this one. It's a really important question. I think we need to, when we frame the argument, we have to change the scope of what we constitute our metrics and really what's at stake. So depending on how you look at it, the economic imperative here is extraordinary, right? The impact on our economy and our productivity is in the hundreds of billions, if not trillions over the long term. In terms of our healthcare system, we're spending $190 billion. If we don't change course dramatically, this current healthcare system will not be able to function when 1 in 3 people have diabetes. Education, has a different metric. The military is the #1 disqualification for military service. So as we keep expanding how we look, we have to make sure that more and more people and major parts of our economy have a stake in solving this problem. And I think as we broaden the stakeholders and really redefine who we see has a stake in solving this problem, we'll be able to start addressing with a much broader lens who's got to be engaging. So when we did the Child Obesity Task Force report, we had, if I recall, this was now a long time ago, like 15 different agencies and departments sitting at the table. Department of Transportation, who had never thought about obesity as sort of part of their, HUD was a major player, the Department of Education, who, that was never part of their work. Huge sort of shift in thinking and breaking down silos. And in fact, in part of that process, people would say, we've never been at the table with all these people on anything. So we have to frame the argument differently, but bring in more and more people to understand they have to be part of this comprehensive solution. And it's very, very challenging to do that. And it's not just, we have to fund in this way because this becomes drops in the bucket at the same time. We need to also have depth of impact. But I think we need to make sure more and more people understand that their objectives are going to be furthered by solving this problem.
I am sorry we're out of time. This just flew by. I think that question, though, is a great place for us to end because it really does bring this all together. If we're going to make progress in reducing disparities, clearly we're going to have to take a broad view. It's going to have to be a systems approach. There's not any one actor or group of actors that will lead to success. And I think if we take that approach and, as Sam has alluded, have very strong goals with metrics that really do focus on reducing disparities in every group, we will have a chance of getting there. So with that, I want to thank my panel and thank all of you for your participation.